Hey there, it's Mark Laperouse here, Our Lady of the Lake Emergency Department. Today I'm working at our North Campus for an airline highway. 6 a.m. Just walked in, did handoff with my colleague. It's kind of refreshing. There's nobody in the waiting room, nobody in the ER today, so get to start with a clean slate. So those little thankful things. Get to start off your morning, maybe have a cup of coffee before you hit the grind. Now time to get to work. See that I'm wearing my mask because I'm inside. Hospital policy. So it's kind of interesting. Every single patient that we see and talk to, we ask all the questions about COVID. Somebody comes in for toe pain, we're still asking questions about COVID. Somebody comes in for abdominal pain, has fever, we're talking about COVID. Just the amount of awareness about this in our society, in our community, is just really interesting and awesome. I think it's kind of allowed us to have better communication skills with our patients because we're asking questions, we're answering questions, we're calming fears. It's just part of our new routine. Somebody asked me today, when is life going to go back to normal? And my answer was, I'm not sure. I don't know if it ever will. I think it's going to change the practice in healthcare forever. And just like that, one more shift is over, under the belt. Overall went very smoothly. We had those few patients that came in that were a little sicker than the rest and required a lot of our time, efforts, but our ER team stepped up to the challenge and took care of business. It was a good day, a successful day. We definitely saw our fair share of people that likely had COVID that are getting tested. Some are going home, some are getting admitted, but it was what we've now seen as the norm in our ED, a little mixture of sick patients that have COVID, sick patients that don't have COVID, and then all of the rest. Anyways, thanks for tuning in. Good morning, everyone. Thanks for tuning in. This is Mark Laperouse again from Our Lady of the Lake, this time on Essen Lane at our main campus. I'm here in the parking lot getting ready to go into work. It's almost 9 a.m. This is an unusual shift time for us. COVID has caused us to really analyze our shifts and our times and figure out when patients are arriving, and so this was a shift that was actually created since the start of the pandemic. We realized that most of the patients are coming in between a certain window of time, so now we have an extra physician in the emergency department during the peak hours. So now we'll have 5 physicians in the building as soon as I walk in the emergency department. So this is kind of exciting. We've used data, we've used analytics. We've kind of learned the patterns. They're new patterns than we were seeing pre-COVID. So I'm going to be walking into work. I'm about to put on my mask. I'm asking everybody to mask for me, mask for us. You need our healthcare workers healthy, strong, and ready to take care of everybody. Baton Rouge community needs us, so mask for us. Thanks. So another Friday, another week down. Finished my 9 to 5 shift that I talked about this morning. It was very satisfying. It was successful. Saw a lot of patients. We saw a lot of patients with COVID-19. We saw a lot of patients without COVID-19. We admitted patients with COVID-19. We discharged patients with COVID-19. It really stresses the importance of communication, helping patients understand the why, helping families understand why we're doing what we're doing, or why we are not testing, or why we are testing, why we're letting them go home, why we feel comfortable letting them go home. So it's, to me, this is the art of medicine. This is why we went into it. It's not just about a test and a result. So again, just another satisfying week, another satisfying shift. It's nice to be off. I love being at the hospital, but I also love being at home with the family. Now it's time for my regular routine after a shift. I take off my scrubs, take off my shoes on the back porch, and I go straight to the bathroom and take a shower, keep myself clean so I can keep my family clean, and then I can start having fun. Thanks.